I'm Anthony Leeds, and it's my pleasure to welcome you to this first of the series of conversations with individuals who've undertaken really exciting work that relates to major problems that are faced across the globe. And what we're going to talk about today is long COVID and the possibility that losing weight may be beneficial to some people. Long COVID, of course, is a problem where the symptoms of COVID persist for 12 weeks after the infection. Now, there are varying definitions for this, but that's the standard one that is certainly used in the United Kingdom. And my guest this afternoon is Professor Mike Lean from the University of Glasgow, and most of the viewers will be familiar with him already because we previously discussed the diabetes remission trials that have been undertaken and are now being applied in the United Kingdom. Mike, thank you very much for joining us. Perhaps we should begin by being clear about what we're talking about with long COVID. What are the main symptoms that people suffer from?
Right. Long COVID is an intriguing phenomenon which people report after an infection with COVID. And in a nutshell, the symptoms they report are essentially the same as other post-viral conditions. So tiredness, fatigue, aches and pains, poor sleeping, inability to concentrate and brain fog. And you'll probably recognize those as the symptoms of what is sometimes called ME, or a post-viral fatigue syndrome, chronic fatigue syndrome, a huge problem which affects, even in the UK, millions of people. It takes people off work. It makes it failing to function in many different ways. And it's a very strange condition which doesn't have any diagnostic features. It's entirely dependent on symptoms which are experienced by people, and in this case, following COVID.
And so, obviously, it's a real problem. And if you look carefully at the reviews being written and also talk to people who are managing patients with this problem, there's not really very much that can be done other than to address the specific symptoms. So it's really sort of almost palliative care for the symptoms, isn't it?
Yeah, I mean, yes, the symptoms are very diffuse and they're familiar. And I think, when a GP has a patient with this catalogue of, hard to get out of bed, can't function, aches and pains, especially pain on moving around, can't take any exercise, they groan because none of them are symptoms which can be solved with any single simple solution. And they're common. About 10% of everybody after COVID seems to have these sort of symptoms persisting for about 3 months or more, and in many cases much longer. So the treatment is symptomatic and not very good. A lot of patients have symptoms which they believe, or the doctor thinks, may be depression, and they get given antidepressants. Antidepressants are not very effective because, frankly, I don't think they really have true depression. They have a constellation of symptoms which can be linked, or aggravated. Perhaps they were, heading that way anyway, and it was aggravated by their COVID infection. And it isn't true depression, although some of the features are seen and reported by people who do have depression.
So, in the light of this problem, what did you and your colleagues in Glasgow decide to do?
Well, it was when when this started to be reported 3 or 4 years ago now, of course, it dawned on me that the symptoms they're reporting, the chronic fatigue, the weakness, the feeling that they've not slept well and have difficulty getting out of bed, pain on exercise, aches and pains in the joints, breathing difficulties, persisting for months on end, it hit me that these are also the symptoms which are either caused or aggravated by being overweight. So I wondered how many of the people with long COVID are actually significantly overweight, and the answer is a lot, somewhere around 80%. So I thought to myself, well, if they are seriously overweight in the sort of obese categories, then some of their symptoms must be to do with their weight. And at that time, there was, and still is, no specific treatment for long COVID. So I proposed to the National Institute for Health Research that we should offer a program to try to take away the symptoms that were caused or related particularly to their obesity. And since there was nothing else on offer, and a lot of them were obese, this was what we did. And so what we did was to advertise through the long COVID associations and through various websites and such like for people who were experiencing these symptoms and were also significantly overweight. We had a body mass index usually above 30. And we asked them whether they would be interested in going through a program which was not going to cure long COVID, whatever that is. And we didn't pretend that we were going to tackle the COVID link, but we offered the opportunity to relieve at least some of their symptoms if they were successful in losing weight. And the interesting thing was that initially there was suspicion that that this was in some way blaming the patients themselves for their symptoms, but a very large number came forward and said, well, look, things are pretty intolerable. We'd like to lose weight. Let's give this a go. And we offered them a program which we've developed and used the same program we used in the direct trial for remission of diabetes, which involves using a formula diet, a very rigid, disciplined approach to losing weight to get the maximum possible weight loss in about 3 months, and then switching onto a more liberal food-based approach to maintain the weight loss thereafter. And we had a control group who did not have this treatment, but were asked just to carry on treating their symptoms in the way that they currently were. And we were then able to compare them at 3 months and at 6 months. Now then, we did another interesting thing, which was our control group, of course, said, well, we'd quite like to get the benefit of this as well, and just to sit and watch the thing deteriorating is no good. So what we did was to offer the same intervention to all the control group patients at 6 months, and that meant everybody had the opportunity to lose weight if they felt that was going to help them. And we are then following them up to 12 months, everybody up to 12 months, to see how the results pan out over a longer period of time.
So interestingly, the other interesting question is looking back at the information that's given about the participants. First of all, I was interested to see that 2/3 of them said that they'd actually gained about 5 kilograms during the actual episode of COVID and also that period since COVID. So it creates an environment in which, for whatever reason, there's a tendency to gain weight, which is interesting. But also, the dietary program that was given, along with the guidance provided by dietitians, ran through with an option to sort of rescue people if they gained a little bit of weight up to about 6 months. These individuals are going to be followed for, I think, 12 months eventually. But I think there was, did you actually have any active intervention from 6 months to 12 months, or is it really just up to 6 months that the intervention is an option?
The intervention is a phased intervention. So there's a initial period of up to 12 weeks, and usually offered for 12 weeks of a formula diet replacement, quite a rigid program. Then they go on to an reintroduction of normal foods, and they're supported with weight maintenance support up to 12 months, and indeed beyond 12 months if they wish it. Now, the support, in fact, the whole program was offered online. And this, again, is something quite radical. People with long COVID, in fact, people who are seriously overweight for any reason and whatever their health problems, have difficulty with mobility. Getting into a doctor's surgery or getting into a hospital clinic is a big problem. They also don't like being looked at, being watched, and they feel they're being judged very often. Commonly, there's a sort of sense that they're being judged as a sort of stigmatization thing. So what we did was to offer this program entirely at home. The formula diet was delivered to them at home. All the interviews, the initial screening interviews, the support interviews and meetings were conducted at home using telephone, using email, using WhatsApp, and even Zoom in some cases. So the patients didn't have to leave their home. And this is important because a lot of these patients had really quite severe mobility difficulties. And so that support was continued up until 12 months and potentially longer.
And the amount of weight lost at 6 months, I think, was just over 10 kilograms. Is that right?
Yes, they lost approximately 10 kilograms at 3 months, and it was pretty well maintained. They actually lost a tiny bit more at 6 months. And so that, for a very difficult group, these patients had a lot of they had a lot of symptoms, and they felt unwell, and they commonly, have just not the concentration to stick with any kind of treatment program. So this was a difficult group of patients. A lot of them had sort of social difficulties as well, and their weight loss, mean average weight loss of 10 kilograms, but they're a big range. So, the range of weight losses went up as far as almost 50 kilograms, extraordinary weight loss in one case, but that was very isolated. The average of 10 was where most people lay. And of course, amongst them, some people just didn't lose weight. They weren't able to stick with the diet program despite all the efforts. But most of them did lose some weight.
Yeah, and in terms of symptoms, self-reported symptoms, of course, the results really remarkably good, weren't they?
Yes, and this again, another sort of first in a study of this kind was that all our data were collected as patient-reported data. They were reported by the patients. Now this is how weight management using the programs. They're called Counterweight Plus. The program is normally run entirely online, and the data are collected by dietitians and checked by dietitians. So we're quite familiar with collecting data. Simple data and even quite complicated. And the primary outcome of this study, and again this is unusual, the first in its kind, was because of the diffuse nature of long COVID and the multiple symptoms, we asked every participant, what is the symptom that you personally would like most to see improve? So some of them said it's the tiredness, some of them said it's the breathlessness, some of them said it's the aches and pains. And we then were able to group the patients according to which symptom they personally felt was most serious. And so we analysed that as the primary outcome, the most likely to make the patient feel better. And it was quite a striking result, yes. So their primary symptoms absolutely got better in the trial at 6 months compared to baseline and at 6 months compared to the control group. So whatever our intervention did, it didn't attempt to treat the long COVID, but it clearly improved their symptoms. And then when we analysed each individual symptom, irrespective of whether that was their worst symptom, if you like, they all improved significantly also, except for pain. So the pains were a bit more diffuse and they were less frequent. And that didn't have statistical significance. They got better numerically. Many patients, if pain was their worst symptom, then that tended to get better. But most people had pain as a sort of subsidiary one, and they didn't feel that there was a big change in pain. However, the breathlessness, the tiredness, the day-to-day fatigue, the muscle aches and pains, those things did get better. The exercise-related exercise difficulties all got better. Their mobility got better. They were able to get out and get up more. And they got back to work, which was a striking result. There were significantly more of the people in the intervention group who lost weight were able to get back to work. And this is a huge issue, which inevitably we think, well, if that works for long COVID, it probably is going to be the same for people with chronic fatigue syndrome, post-viral syndromes who are also overweight. So, which is a much, much bigger problem than long COVID and a huge drain on national resources in Western countries. So this kind of chronic fatigue syndrome, which doesn't seem to get better with other treatments and is very difficult to pin down, certainly hasn't been defined. If people are significantly overweight, there's a good chance that this program, this weight management program, will actually help with their symptoms and possibly get them, fit enough to get back to work.
Mm-hmm. And of course, it was interesting to look at the pattern of employment for the individuals who participated, because the infection in the first place caused a proportion of those who were in full-time employment to move to part-time employment, and similarly some to actually stop working altogether or to take early retirement, which of course across the whole country and indeed across the whole globe does have a really quite serious issue. So all of that is very exciting. I mean, in addition to the changes to body weight, there were improvements in blood pressure and no doubt improvements in all the other sort of metabolic changes, including presumably some sort of markers of inflammation. Were any of those actually measured in the blood?
Not in this study, Tony, because this was a study conducted among people who were at home. They didn't come into a clinic, so we didn't have the opportunity to take bloods and such like. And I think in some ways, in this study, which was directed at their symptoms, the first step is to say, well, can we help with the symptoms? And you're quite right. We then ask ourselves, well, how did that help with their symptoms? And one possibility is that COVID, like many other virus infections, can set off a kind of chain of inflammation. And if people are significantly overweight, then the inflammation is always going to be worse. And so it would be very interesting to measure inflammatory markers during weight loss. And we have evidence from other studies that they improve. So I think it's very likely that that would be the case. I think it's important, though, to say that the weight loss required to make this symptomatic improvement is more than is usually achieved by ordinary, if dietitians are ever ordinary. We in the European setting, we're looking at a weight loss of 10 kilograms or more, and certainly setting a target of 15, because that if we give them a target which is challenging, then there's at least a chance we will get a number of them past the 10 kilogram mark. It did seem that once people get beyond 10 kilograms, that was the level at which their diabetes remission tended to occur, and their metabolic improvement in other spheres all seem to be dependent on getting more weight loss than is customary in ordinary weight management. And that's why we elected to use this slightly more aggressive or more definite intervention. We're using a formula diet to get the greater weight loss. Not everybody, I would have to say, not everybody chose to use the formula diet. There were a number of patients within this who said, look, we don't terribly want the formula diet, but they felt they were able to discipline their eating using advice which came the same route online with telephone, Zoom, etc., WhatsApp, from the dietitians. So it isn't absolutely necessary to use formula diet, but most of them did, and across the board, that does seem to be the most reliable way of getting significant weight loss. And then, as you say, we offered them the opportunity, should their weight tend to regain at some point during that 6 months, we offered them a short period back on the formula diet to kind of check their weights, keep it back down to where it should be.
So in the light of all that, which is very exciting, what would you like to see done next? I
think the main thing here is to recognize the really quite profound benefits from significant weight loss. And we're seeing this now in so many different areas. The benefit for type 2 diabetes is absolutely staggering. And I think for both type 2 diabetes and hypertension, a weight loss of 10 kilograms is far more effective than any of the drugs that we can offer. All the clever medications that we have fall behind the effect of 10 kilograms of weight loss. And so looking now for other areas where we're seeing benefit from significant weight loss, the world opens up. There are many diseases where a substantial weight loss, and I don't think we should be stopping at 10 kilograms. I think many of our patients, start with a body mass index of 30, 35, or even more. They'll lose 10 kilograms and their body mass index is still above 30 or often above 35. So they've really got a long way to go to come down to what one would regard as ideal or optimal. And of course, then that means we should be trying to deal with the weight problem much earlier in life before people run into difficulties. So we've got two things to do. One is to recognize the damage which being overweight is doing over a period of years, how it aggravates so many other diseases. Secondly, if people have become overweight, then offer them a very definite, disciplined approach, which will get substantial weight loss. And as in Matistan, we're not terribly good at getting the weight loss maintenance. We haven't got the 12-month data in the long COVID trial yet, but I think we expect that there will be some regain of weight in that time, but commonly is. And we simply haven't had resources to research and optimize the long-term weight loss maintenance. In terms of long COVID is still a problem. I mean, COVID is not in the headlines anymore. It's still very common, and it's one of many SARS-type viruses which will generate a kind of syndrome of this kind in susceptible individuals. And I think probably we're looking at individuals who are susceptible to a chronic fatigue state, which is triggered by many things. It can be triggered by social things, it can be triggered by physical things, or it can be triggered by infection. And what this study has done is to say, well, at least we can apply a known, tested treatment to achieve significant improvement in the worst of their symptoms, get them back on their feet, get some of them back to work. So I think we've made a big step forward there.
So my last question, and viewers who are listening and watching will be asking themselves, well, do I have to wait another 3 to 5 years before all the evidence is in, or can I go ahead and lose weight now if I've already got if I've got these long COVID symptoms? Shouldn't I try by any means to achieve that amount of weight loss by whatever they choose to method they
Yeah,
choose?
yeah.
Can they?
Yes, you don't. I think people who are significantly overweight will have many, many conditions aggravated. They will have symptoms added to other problems. And of course, simply being significantly overweight can generate these symptoms of fatigue, tiredness, the aches and pains, muscle aches, exercise intolerance, difficulty sleeping. They wake up feeling unrefreshed, difficulty getting out of bed, and often, if you measure the sleep, it is very poor. People who are significantly overweight do not sleep well, and they end up with respiratory difficulties because of that. So
Mm.
I think the message is that anybody who's significantly overweight or is in a position to advise people who are significantly overweight, then there are many treatments, many interventions which can achieve weight loss if the individual is well supported and motivated. Yeah, don't
Okay.
wait, don't
Sorry.
wait.
No, thank you very much. That's great. Thank you very much for summarising that. We look forward to hearing more in the fullness of time. So, Mike Lean in Glasgow, thank you very much for talking to us this afternoon. As usual, there will be information underneath this video window on the screen, giving some links to useful sources. So, thank you very much, Mike. Thank you.
Thank you.